messenger RNA, mRNA inside, the CD8 T cell will recognize the vaccine as a foreign body, will destroy the exosome. This RNA is red. It's a reading. And then after that, either way, this portion will be destroyed or it'll be used for directly used by the T cells, CD8 T cell killer cells, or will be used for to memorize this code, so it'll be further used by CD4 helpers that will present that to other cells like the B cells, or the and will keep memory of this. And after that, you need an intact immune system, or a functioning immune system, even if it's a little bit slower, like with age over 80 years old, we know it's slowing down. You can have this information in memory in the B cells or the CD4 T cells, and for another exposure, they will be kicking in the killer cells or the antibodies. The antibodies will bind to this and this disease that overproduces, generates the overproduction of antibodies, B cells and antibodies. So the immune system is completely hacked. It's the cancer and produces erroneous, like completely wrong antibodies that will not recognize anything. They're not working. It's probably that produces the most antibodies. It's overwhelming, and it's non-functional. So there are also other pathologies like immunosuppression by several diseases, post-cancer, and we know a lot of infectious disease that will decrease the production of T cells and B cells and antibodies. So these patients will be at more risk. So in that case, we need to start to an evaluation of the situation to see whether the vaccine works or not. Vaccine works in case of a normal functioning immune system. If it's not functioning, there'll be trouble to produce the antibodies and getting rid of the viruses. So age, you've seen it's authorized age 5, beyond 5 and older, and it seems like we study that to make sure that there's not an overreaction, overproduction, and like overwhelming reaction to the virus or to the vaccine. It's why we study by age, like stratum. It's called a stratum, by strata of ages. This is a normal practice, a normal way of looking at those. We need an intact immune system to react to this portion of RNA. Intact, it will recognize. We could think about other things. There's also a medication from Merck that binds to the virus genome RNA, and will destroy the way the virus produces things. So that's another way. It would be for the immunocompromised, may be the way to go for elderly over 90 years old, centenarians, and also immunocompromised post-cancer or multiple myeloma patients or HIV patients.